Good morning, everyone.
Hi, everyone. I'm Kayla David.
And I'm Sarah Kelly Palmer. Welcome to Be Well Live. If this is your first time joining us here, we are Kayla and Sarah, and we work at the Healing Department at Family Service of Rhode Island. And we gather here every other week as part of our Be Well Live information series, where we talk about a host of different topics related to how to cope during the COVID-19 pandemic. Family Service of Rhode Island is a social service agency that has been serving Rhode Islanders for over 125 years. And we offer a variety of different programs, including telehealth counseling.
So, we will be joining together today and every other Wednesday at 10 a.m. for discussions to support wellness during COVID-19. We ask that you please take a moment to share this with your friends or to start a watch party if you're watching on Facebook. Help us reach as many as we can to share this important information about being well during COVID-19. Now more than ever, it is so important for us to be able to reach out if we are struggling or to help our loved ones be able to connect with assistance if they're struggling with COVID-19. COVID-19 has put a great deal of stress on all of us in so many ways that are impacting our well-being and our mental health.
So I am really excited about our topic today, Kayla, because it's very timely. October was first declared as National Substance Abuse Prevention Month in 2011. And since then, the month of October has been a time to really highlight the vital role of substance use disorder prevention in both individual and community health, and also to remember those who have lost their lives to substance use disorder, as well as to acknowledge those who are in recovery and their children, parents, family, and friends supporting them in that journey.
Yes, COVID-19 has hit our community hard. When dealing with the stress of this pandemic, individuals who are impacted by substance use disorder are particularly vulnerable. And with the increase in stressors in all of our lives for the last 8 months, the question then becomes, are we at risk of increases in substance misuse as a community? Joining us today to discuss this important topic is Erin Albanese. Welcome, Erin.
Hi, Erin.
Thank you. Hi, Sarah. Hi, Kayla.
Erin is a independently licensed clinical social worker and a licensed chemical dependency professional. Erin is the program director for Project Support Ocean State, which is a collaboration between Family Service of Rhode Island and Kodak Behavioral Health Care to respond to the needs of children and families impacted by substance use.
So, Erin, we're really excited to have you on this morning. Thank you so much. So we thought we'd just start off with having you share a little bit about your work at Family Service of Rhode Island and Project SOS, as Kayla mentioned, and just overall kind of your work in the community around substance use disorder.
Sure. Thank you so much. So, yes, I have been working with Project SOS for about 2.5 years now. And we are a program funded by the Office of Victims of Crime. So OVC has identified, a population of children and families who have been impacted by substance use disorder through a variety of measures, if you will, that need support. So Project SOS supports families who have been impacted by substance use disorder. Primarily, we serve children of parents who have struggled, who are struggling, or who have been lost to substance use disorder. So we work with grief and loss. We work with sort of symptoms of stress and trauma. We also provide skills training to parents, skills training to professionals. So another big piece of Project SOS is informing the communities about substance use disorder and trauma-informed care. So when families are impacted by substance use disorder, there's a higher risk of the family being impacted by trauma. And so we think it's very important for providers to be informed about how trauma impacts substance use disorder, and vice versa, how substance use disorder is impacted by trauma.
Well, thank you, Erin, and thank you for your work. We're really excited to talk to you today. One of the things that I think is really important for us to start off with is that there is so much stigma and so many myths about people who use substances or are in recovery. Can you share some of the common myths about individuals who are impacted by substance use disorder and how those myths and stigma impact our community?
Sure. Yes, it is one of the pieces that has been such a struggle for generations historically. So substance use disorder impacts all populations. You know, I think one of the myths is there are certain socioeconomic groups that are primarily impacted. But the truth is all socioeconomic groups are impacted. So addiction is also not a choice. Addiction is a disease, so it impacts the brain, it changes the body. And what we know is that addiction needs to be treated, substance use disorder needs to be treated with that social, emotional, and clinical and medical interventions. There's just not one thing that is going to help a person move into recovery. In fact, that stigma that has been created and continues to sort of impact the folks who are struggling with substance use disorder, the impact of that stigma is detrimental, and that we sort of own that stigma. We own that this is a choice I should be able to stop. And what that further does is it restricts us from getting help or asking for help or showing that we need help. And it impacts that further, addiction, substance use disorder. One of the symptoms is isolation, and it, drives us into more of an isolative and dangerous, high risk sort of environment, while we are placing that now stigma on ourselves.
Got it.
Yeah.
Yeah, and I think, there's been a lot of, Erin, sometimes you hear professionals kind of compare it to, you wouldn't really kind of blame someone for having cancer, right? Or having another disease, right?
For diabetes.
Right.
Yeah.
So you often hear that. And I think that it's so important for people to kind of understand what you're saying around that this isn't a choice, right? For people who are impacted.
Yeah. And, the other myth is that addiction lies within itself. It's its own sort of thing, but it's very much not its own sort of thing, right? It changes the body. It changes the mind. There's been some great work by a lot of researcher, Bessel van der Kolk, that I think of, the first off of my head, the body holds the score, and addiction is often a symptom of something else. Addiction is not really the primary issue at hand. And, but addiction and trauma, which we know go hand in hand, changes the way we think and react to certain stimuli in our life, in our environments, right? Mm-hmm. And so it's learning how to become more aware of those events in our life that are changing our body and how our body changes. Yeah.
So I think living in the midst of COVID-19 is such a unique time for all of us, right? And, I think that, especially in the beginning of the pandemic, we were seeing a lot on social media and a lot just kind of in media in general about, people kind of COVID snacking, but also like COVID drinking, right? So like, I think of businesses were closing and shutting down, but liquor stores were thriving, right? So this idea that in particular during this time of stress, this collective stress, people were really drinking more, right? Or perhaps using other substances at a higher rate. And, for those not impacted by substance use disorder individually, I think, thinking about having a glass of wine, for instance, isn't necessarily a bad thing, right?
No, not at all.
Right? So I think a lot of people aren't sure about kind of when too much is
Sure.
too much,
Yeah.
right? Or kind of knowing when to make the choice to use alcohol or enjoy alcohol
Right,
and
right.
kind of
What is
when it
moderation?
tips, right?
Yeah,
Yeah.
what is moderation? Right.
Yeah.
Yeah. So, and I think, yeah, that is something that's very relatable, very realistic, and impacts very many of us. And I think, I think informing the populations, informing the masses, understanding that stress impacts our body, right? It impacts the way that we modulate
Yeah.
our sort of self-soothing activities, right? Our sleep becomes interrupted by stress.
Mhm.
But, alcohol and, other substances give us this message that it helps, right?
Mm.
So, and sometimes it may,
Mhm.
but there is a threshold to be aware of. So I think primarily understanding that stress changes our body, and our
Okay.
body wants something to fix that change. We can, understand that there are sort of guidelines to alcohol use, and
Mhm.
that includes, if you're drinking a whole bottle of wine a day, it's not going to help. It's not making sense. It also doesn't fall within those guidelines. So
Mhm.
3 to 4 6-ounce, 3 to 4 drinks
Mhm.
a day is within those guidelines. There are
Mhm.
gender specifications, excuse me.
Okay.
Males are 4 drinks a day. Females are 3 drinks a day, not to
Mhm.
exceed a weekly allocation. For males, it's 14. For females, it's 7 a week. So to be mindful of those sort of guidelines. If we're
Okay.
falling, outside of those thresholds, maybe some changes need to take place, right? And we also want to consider there are, social and financial, professional, educational consequences of,
Mhm.
increased consumption. And we want to be mindful of what those consequences are too, right? Are we starting to drink more than we had when maybe COVID first started,
Mhm.
right? Are we
Mhm.
having a drink a day or 2 drinks a day? And now is it, we're collecting our corks in a bowl,
Right. Yeah.
thinking about how much has been, how has our activity changed from the
Mhm.
onset of maybe a stressful event? Have we tried to cut down, and has that not worked?
Mhm.
Right? Do we have cravings? Do we think about, when that next drink is, when we can use again? Are we having those cravings or urges otherwise, that are interrupting sort of our attention? Are we distracted by it? Are we experiencing maybe problems in our relationships that
Mhm.
might be impacted by substance use or alcohol use? Are we doing our preferable activities, kind of devoted to alcohol use or substance use? And are we giving up in, professional or, social events because of
Mhm.
our alcohol use? And it's oftentimes alcohol use, substance use impacts our medical, well-being or
Mhm.
our physical
Mhm.
well-being. And do we continue using over those maybe diagnoses when we shouldn't be? Or are we aware of those consequences and we continue using? So putting our medical and physical health at risk. And finally, are you noticing with those cravings and urges, maybe some symptoms of withdrawal? So symptoms of withdrawal is an increased sense of anxiety. Might be difficult to kind of ascertain during these times as we're living in this heightened sort of anxiety.
Right.
Increased blood pressure, kind of thoughts of using or drinking in the morning. And so being mindful of what those risk factors are and looking at where we can kind of build in support to reduce some of those risk factors.
Well, and Erin, I think this was so important because one of the things that I was thinking is like, okay, so three drinks a day, but then it was 7 drinks a week. So again, it's, 3 drinks in one day might be okay, but then if we're doing that every single day, our weekly total might tell us as one of the, guidelines or one of the things that we need to look at, that might be happening too much. And I do think, as Sarah was saying earlier, there was so much on social media at the beginning of this. I remember watching a meme of someone, with their wine at work, right? Because you're working from home. All of those things that normalize maybe some of this.
And the size of the wine glass, right? Is this, and is there?
Oh,
that's one of those pieces that we need to be mindful of. We could be having one drink after work, but what's in that drink really, and how large is it? How many different ingredients, and what size are those ingredients that we're putting in there? How much of it? So thinking about one drink is 4 ounces of wine. Right? And 4 ounces of wine is quite small. 6. It's very different from what we receive at maybe at an establishment. Same thing with a draft beer. A draft beer is actually 2 servings because so just thinking about the factor of those guidance amounts. Yeah.
Well, and as Sarah was saying earlier, COVID-19 has put a tremendous amount of stress on all of us and is a very unique situation, one in which none of us have ever been in before, where really so much of our community has transitioned, and our rituals or our practices are very different now. With all of us being inside more, and as we're thinking about winter, which is going to really move us all inside, and we have less to do and more stressors, are you seeing any concerning trends, or are we seeing anything in our community that we should be concerned about?
Oh, absolutely. Absolutely. And concerning is a light word right now. We're actually experiencing some significant trends that have put us back to crisis numbers that we've experienced in 2017. So the Department of Health has been releasing numbers of, specifically opioid overdoses, right? And those numbers are actually superseding the 2017 numbers. So in isolation, folks are in those restrictions of the pandemic to isolate. Those are actually the most harmful environments for folks who are struggling with substance use disorder to be in, right? And so we are seeing a significant increase in isolative overdoses. So restricted access to support, restricted access, and these are those trends, access to medical care. So we've seen an increase in unemployment, right? Which means there's an increase in folks not having their medical insurance, or at least a gap in not having their medical insurance, right? So resources may be there, but they're not immediately accessible. So the other trends are the black market use. So substances are not readily available on, in the community. So folks are accessing substances on the black market, which are much more dangerous and much higher risk. And the other trend, again, is so increase of folks in care, so accessing treatment. So our numbers for alcohol use disorder inpatient detox centers has increased significantly.
So more people might be in those services, which means less access for others that need them. Erin? Possibly. Okay.
I mean, there's the common term, we don't have a bed, right? No beds available. So there's waiting lists, and reoccurrence of substance use does occur. Those folks are higher risk for overdose, and so the cycle begins.
Got it. It also makes me think about, Erin, how within the context of COVID-19, because of all that we're talking about, right, the stressors, the vulnerabilities, that we have seen an increase in things like depression and anxiety. You mentioned before, sleep disturbance, and that connection with trauma and traumatic stress symptoms. Just kind of overall in the general population. So for people who are impacted by all those things prior to the pandemic, it's just exacerbating them. But I also think in general, we're seeing people who maybe didn't necessarily struggle with depression previously now being impacted by it. So how does kind of that mental health impact during this time kind of relate to those trends or those things that you've been talking about substance use?
Sure. So just kind of as I spoke to earlier, the body changes, right?
Yeah.
So the stress and the trauma of, so other trends, just kind of want to talk about homelessness, food insecurity, right? Other trends are really impacting folks who were in a secure environment and now are unsecure and now are experiencing those traumatic stressors. And so what's happening in our body is that our body is trying to accommodate that trauma and that stress, right? So our brain is, sending out all these hormones trying to moderate, but in fact, the body is living in a stress state. So I think, there has always been this talk about cortisol, right? The toxic stress hormone, right? But the reason why it's toxic is because it disrupts our sort of self-soothing hormones, those hormones like the dopamine and serotonin that help modulate a traumatic event or a stressful or normal stressors. And so it's actually eating up the dopamine and serotonin, right? And it's impacting the way our body functions. And so with that, we're having less dopamine, less serotonin, a more difficult time modulating some negative thoughts or negative thoughts or racing thoughts, which is the symptom of anxiety, which is the symptom of stressors, increase in stress, right? And so how does substance use impact that? Well, the brain is a very powerful organ, right? And we have this thing called the reward system. And it tells us when we do something enjoyable that makes us feel good and that works with our body, that we've done the right thing and to do it again. So when we are living in a stress state, as many of us are right now, and maybe enjoy a glass of wine over and over and over again, our body is telling us this is the answer to your stress because it makes us feel better. And it actually pushes our dopamine button, if you will, and elicits 25 times the amount in a normal state of dopamine to our body.
So that's that pleasure, right?
So that's that pleasure system becoming satiated with a glass of wine, other substances, and that's how our body becomes sort of on a track that could be risky. Yep.
Erin, we have a viewer, Margaret. Hi, Margaret. And she asked, and I think this is the perfect question related to what you're just talking about with our dopamine buttons. Do you recommend other activities for youth and adults to reduce that anxiety and to increase ultimately that pleasure during this difficult time instead of alcohol and drugs?
Sure, absolutely. And so that dopamine is created within our body. Our body knows how to create it, right? And serotonin is one of those things that help us calm down. And in fact, it's physical activity. It's disconnecting from that stress around us and allowing our body to be able to kind of connect with itself and to replenish in itself, doing joyful activities. If you are, privileged enough to have family around you, to have support with you and connections, connect with that support, have conversations, meaningful conversations. Those are the things, in fact, that build pleasurable moments and dopamine in our body. And I can't say it enough, physical activity, getting outside, allowing your body to breathe in and out. Those simple actions of breathing in and out of fresh, cold air or warm air or salt air or outside air, any sort of air in and out, changes your brain. And if you do those slow breathing exercises once or twice, you'll notice a difference. But again, it's that physical exercise. It's that connecting with others, engaging with pleasurable people and activities.
Great. And I think, Erin, it sounds so simple, but with all of us, I know for us at FSRI, many of us are still physically at home. And I have to say, I've had to be really intentional because there's days that can go by that you're just so busy that you don't do any of that physical activity or you don't get outside because there's there's not as much to do out there. So I do think it's an important reminder to kind of just check in. When was the last time I did something physical? When was the last time I physically went outside, especially if we still have people who are working from home or who are isolating or who are doing distance learning, we can get very, it can be very difficult to get out of the house.
And also for, as we talk about this, what consistently comes up for me is not all of us have that motivation to go outside, access to go outside into a safe environment, right? Or have folks in the house that we can create pleasurable activities with. So, I also think that that's on the shoulders of our providers in creating those resources that are available. And there are resources available to folks who are in those sort of, in those states of mind, difficulty to kind of change or shift that energy and find that motivation, because it can become an uncomfortable, distressful cycle for folks who don't have access to those resources that otherwise we would.
And we're going to share some of those resources after our broadcast here. But I'm so glad, Kayla, you kind of also highlighted the helpers, because I do think, right? And Erin, so you're saying there are resources out there, people who are helpers out there professionally are working hard to make sure those exist. But I think it's so important for us to also take care of those helpers, right? Because we are all in this pandemic together, and that idea of, as Kayla mentioned, just, working from home and distance learning and all of those things, that compassion fatigue that could happen. What would you say to those helpers right now that are working hard to help others, but that might be impacted themselves?
So I say flip the script for yourself, right? Help yourself and find those words and those messages of compassion for yourself. And really, when we're working in this helper world, compassion is our antidote to burnout. It honestly and truly is. And the more that I have worked with trainings and skill development around building compassion, I have found not only has my self-care improved, but my burnout, my risk of burnout. And I have seen many folks burn out. I've burnt out myself before I was able to really truly understand the meaning of compassion and the skills of compassion. And so, one of the best ways to understand how to flip that script and be compassionate for ourselves is to really, what has helped me is sort of getting a better grip on what we call motivational interviewing, right? And the skills and techniques behind motivational interviewing are to create change, but the foundational theory of motivational interviewing is embedded with compassion. And it's doing that work within ourselves and finding where our compassionate strings are and play them for ourselves and understand that love must come first, understanding and non-judgment. And we are better equipped with those skills to serve ourselves, and therefore better equipped to serve the populations and preventing burnout. We become re-energized, even possibly within a world living in a pandemic.
And I think on the same note, kind of many of us are also kind of, not only it's good to look towards ourselves and have compassion to ourselves, but there might be people out there watching who are concerned about others in their lives, loved ones, work colleagues, family members. What can people do if they are concerned, Erin, about either their own use or use of a loved one? What should people do?
So again, a bit of self-reflection. I always say start with, what are your concerns? And are there any assumptions embedded in those concerns? And disconnect with those assumptions. Assumptions lead to judgment, and we really want to kind of disconnect from any of our concern to create further stigma. Because sometimes our concern comes out of a place that might be stigmatizing. Finding what that concern is and communicating that concern and asking questions, becoming curious and listening. And knowing that there is support available, and if someone is asking for support, then we can provide that support. On the onset, understanding your concerns, understanding the impact of substance use, and that substance use typically isn't the primary problem.
Mm-hmm.
And
so staying out of judgment, coming from a place of concern.
Yeah.
Oh, Kayla, we can't hear you.
Oh, sorry.
That's okay.
We did have a viewer ask another question. If I know a family that has someone with an addiction problem and may benefit from the SOS project, how do I help them find out more?
Sure, absolutely. We call our Family Service of Rhode Island intake department, and all of that information will be available on the screen right now. And the intake department can certainly explain our program and go through some of the criteria, and we can absolutely find services to meet the family's needs.
Great. And are there any other resources you'd like to highlight in Rhode Island that might be available for those struggling with substance misuse, substance abuse disorder, or families that are impacted by substance use disorder?
Sure. So the go-to site for Rhode Island is BHDDH, so Behavioral Health, Developmental Disabilities in Hospitals. They have a website and also a phone number. Go on their website, and there are comprehensive lists for services for mental health, counseling, substance use disorder treatment, and beyond that. So that is our most resourceful sort of hub for services in the state of Rhode Island. If someone is in immediate need, or there's an emergency, a medical emergency, of course, call 911 first. If someone is seeking treatment but not sure what type of treatment there is, we have a behavioral health link in East Providence, Rhode Island. They're open 24 hours a day, can do a phone assessment direct to the level of care that's needed, or you can go, it's a walk-in center as well. You can go there in East and present to them your needs. And that phone number is 414-5465, so 414-LINK.
Great.
And I think one of the things I also want to just highlight, Erin, which I think is one of the things that is so unique about Project SOS, which you alluded to, but I always love to shine a light on this, is that oftentimes when an adult, a parent, a caregiver is impacted and struggling with substance use disorder, much of the people are paying attention to that, right? Which is a good thing. But sometimes when there's children involved, right, particularly young children, people might not necessarily take the time to think about the impact on those children. And I think what's so unique and wonderful about Project SOS is that is what really the treatment is for, is to intervene with children and youth whose parents might be struggling with this, because we know that can have an impact on them as well. So I just kind of want to thank you for shining a light on that through this program and all the work that you do, because I think sometimes we do kind of forget that in the midst of, a crisis where someone really, they themselves are reaching out to kind of go to detox or treatment, right? Sometimes kids get lost in that shuffle, and it's so important to pay attention to that. So I just wanted to highlight that.
Yeah. And I think one of the great things I get to, we lost Erin. I get to work with Erin a lot. One of the greatest things that I think comes out of this is it really is a family approach to treatment.
Yes.
I've worked with a lot of parents who are in recovery and are really struggling to find developmentally appropriate language to talk to their child about their recovery, their substance use disorder, or maybe that child's risk for substance use disorder in the future, right? And how do we help people? One of those pieces is information and developmentally appropriate information. And so I think Project SOS really does take that family approach centered around that child and their needs, and provides that the developmentally appropriate lens to how do we talk about this? Because for many parents, it's one of the most difficult and challenging conversations. And yet it's so valuable for those children to understand in an appropriate way what is going on, because they know something's going on. They have
Right.
questions, and that can be really difficult for parents to kind of navigate. How do we talk about that?
We lost Kayla.
Oh no.
It's okay. We're having just a few technical difficulties today, but that's
Oh, it's a
okay. Yeah, so
rainy
I
day
don't know if you
outside.
wanted to say anything about that, Erin, and that importance of talking to kids before we wrap up. But
Some of the best work we do is when families are working together, and that's really one of the pieces that is so important about SOS is keeping families together, right?
Yeah.
And opening up conversations, opening up relationships and family systems so that we're comfortable communicating. We're not keeping secrets. We're opening up to breaking that cycle, right? And what we do know is that the cycle is a learning cycle, right?
Mhm.
And we're learning practices and behaviors from the people that are caring for us. And the more that we can teach.
Well, everyone, I think we're having some technical difficulties. So this was an amazing show. Thank you all for being
She
here,
can't
for
hear us.
listening.
All right. Sorry, Erin. I don't know if you want to
We'll
finish
just
that
shut
thought
her
before
off.
we wrap up.
When we can really work with families, we can work to break the cycle.
Yeah.
And what we know about substance use disorder and what we know about trauma is that it is generational, right? And it may be more learning than genetic is also what we're learning. And so if we can infiltrate that learning cycle, provide promotive skills, emotional attachment, reattachment skills with the caregiver and children, we can really work together to break that cycle. And that's what's most exciting about this project, is that we're working with families to keep families together.
Thank you, Erin.
Yeah, Erin, thank you so much for coming on. I know we had some technical connection issues there for a second, but thanks for holding in there. Thanks for being here. And we will post, as Sarah said earlier, some additional resources for people. Thank you all, our viewers, for being here today. We look forward to coming back next 2 Wednesdays at 10 a.m. for more discussions related to COVID-19 and wellness. And if you have a particular topic that you're interested in us discussing, please comment in the chat box or send us a message, and we will certainly cover that topic.
And please remember, if you or someone you love is struggling with managing stress and anxiety during this time or is impacted by substance use disorder, we want you to know, we know that this is hard, but we are here to help. We have clinicians who are able to assist through telehealth services. We, have Project SOS, which is a wonderful program. So please give us a call, and thank you all. Be well.
And be safe.
Thank you.
Thank you.
Thank you, Erin.